Hi guys, so my ISBAR for this patient, I would start with the I, which is saying, hey, my name is Sarah, I'm the nurse on the med-surg floor, taking care of CK. He's a 71-year-old male and he's in room 272. My S would be, I'm calling to give a report on CK. He has pneumonia. However, his IV antibiotic medications have indicated proper therapy because his cough is only productive of white sputum. His temperature has decreased from 103 to 100 degrees Fahrenheit, and his pulse ox has been 98%. His oxygen saturation is 98% on 2-liter nasal cannula. Previous test results would be his glucose was at 254. His white blood cell count was elevated to 1800. His A1C was at 9.1 and his potassium was low at 3.4. My B would be he was presented to the hospital with a fever 2 days prior, and he had been shaking with the chills. He had a productive cough and dyspnea upon laying down. He has a history of type 2 diabetes, coronary artery disease, a myocardial infarction with a stent placed. He's currently on Lopressor, Norvasc, lisinopril, and for formaldehyde Lasix. He's also on metformin for his glucose and Avandia. Sorry, don't know how to say that one. However, we were able to give him Rocephin at 1 gram per IV, which seemed to really help with the pneumonia infection. We did check for a UA, blood culture, CBC, BMP, and a chest x-ray to confirm the diagnosis of pneumonia and pinpoint the organism causing the pneumonia. The patient did say he had an allergy to an antibiotic that was oral, but he was unsure of the name, so it gave him hives. My A would be looking at the patient and seeing what he has discussed, talking about his lack of preventative care such as vaccinations, the lack of adequate nutrition, just eating red meat and frozen foods, the lack of physical exercise, saying that he does not exercise, and the lack of emotional support that he could receive has seemed to cause a lot of these problems. However, upon talking to the patient, he does seem to be motivated to receive vaccinations upon discharge, as well as acceptable to receiving Meals on Wheels to get the proper nutrition he needs. He also stated that he would go on daily walks to help prevent his lung strength, and the patient discussed meeting with a counselor from his church to have that emotional support, especially with losing his wife. My R would be, upon discharge, I would vaccinate him for pneumonia and flu upon his request. I would put in a request for nutrition to meet with the patient to ensure proper nutrition and to set up Meals on Wheels. I will also contact social services to help set up daily checkups for the patient. And because he lives alone, his wife passed away a year ago. I will promote daily exercising, and I will also encourage the use of a incentive spirometer to help monitor that lung compliance and kind of motivate him to keep going until he can get to a really good level. I also want to provide proper education on the use of an incentive spirometer in case he's never used one. And I will ask him to teach it back to me. I will also make sure that the patient is able to go home with without the use of a nasal cannula, oxygen, with his statin around 98%. Lastly, the thing I would really want him to know is that whenever he is sick, to continue taking his glucose medication, because when you become ill, a lot of times your glucose can rise, which because of the sitting around, and also just from the stress of being sick. When I prioritized his care, I really put forth checking his vital signs, making sure that his blood pressure and his heart rate, his O2 stats, his temp, were in a good range. The temperature could show, like, risk of infection, and I would want to assess his lung sounds to make sure there's no crackles in the lungs, to see if there's fluid in there. I would want to check his skin to make sure tissue perfusion is adequate. I don't want any shunting away from the areas, and make sure that the body is not moist or pale, or any cyanosis in case of hypoxia. I would also want to check his neurological assessment, so making sure that he's not too agitated, restless, because that is a sign of tissue perfusion. So that's what I would put there. My top 3 nursing diagnoses were impaired gas exchange, and risk of infection, and ineffective coping. I picked those 3 because gas exchange from the pneumonia, and the fluids in the lungs, causing that, and it impaired gas exchange in the lungs. The risk of infection, having the pneumonia, having no vaccinations, that kind of stuff. We could, the fever of the temperature can lead to sepsis. And ineffective coping from not being able to adequately share his emotions with anyone, especially with his wife passing and being alone. He might be very sad and not really dealing with this stress effectively. And so that's what I base my stuff around for this patient. Hope you guys agreed with what I did. Thanks for watching.